PCTI, or Person-Centered Trauma-Informed Care, is a holistic approach that acknowledges that trauma survivors have distinct and extraordinary needs, and that the delivery of healthcare services they receive must include an understanding of these needs to avoid re-traumatization. Stay tuned to learn more. Welcome to Aging Insights. I'm Dr. Kathy Rowe, Executive Director of New Jersey Advocates for Aging Well. Our guests today are Debbie Roxar-Rosen, the Community Program Coordinator at Jewish Federation of Greater Metro West New Jersey, Dr. Howard Drew, Director of Implantology and Vice Chairman of the Department of Periodontics, Rutgers School of Dental Work, Social Worker Liz Levy, the Coordinator for Holocaust Services at Jewish Family Service of Metro West New Jersey, and Social Worker Peter Jacob, Program Coordinator of Project CEASE, which is Combating Elder Abuse through Supportive Services and Education at Jewish Family Service of Central New Jersey. Thank you for joining us in the studio. I want to note that our guests, staff, and team behind the camera are all vaccinated, and we thank you for that. So Debbie, let's start with you. You and I met about a year ago when you did a presentation on PCTI, and my first reaction was, so many people can benefit from this approach. Why isn't it more broadly used? So can you tell us, how did Jewish Federation of Greater Metro West learn about PCTI, and why and how did it start educating the community?
Thank you very much, Kathy. So Jewish Federation of Greater Metro West is the largest Jewish philanthropy in New Jersey and encompasses several counties. We encompass Morris, Essex, Union, Sussex, and parts of Somerset County. And Federation's mission is to care for those in need and of all ages, and to build a Jewish community locally in Israel and overseas. So within the Federation, we have a CARES department which focuses on the needs of older adults. And over the past few years, the CARES department has received several grants from the Jewish Federations of North America. These grants supported using Person-Centered Trauma-Informed Care, or PCTI, as the approach to care for Holocaust survivors. And most recently, they've broadened the reach to include caring for other older adults with a history of trauma. So that's really through how Federation got to know about PCTI, was through these grants, and how we then started to educate others about it. Mm-hmm. The grants are specifically supporting programs for Holocaust survivors, programs in Soma and South Orange and Maplewood for older adults with a history of trauma, as well as Project CEASE, which you mentioned earlier. So we started educating those staff and those caregivers, and then over time we've broadened the reach and we've started to do programming and education for others who also deal with older adults. When you ask sort of what is PCTI, it's really, as you alluded to at the beginning, it's really an approach to take care that it takes into consideration what someone's life experience has been. Mm-hmm. What is the trauma that they potentially have endured during their lifetime? There's a statistic from the Journal of Traumatic Stress from 2013 that suggests that 90% of older adults have experienced a trauma in their lifetime. Wow. It's sort of a striking statistic, but given the challenges that people face both on a personal level and when you think about what goes on in the world, I mean, mm-hmm. living through the Great Depression or the Holocaust or even most recently the pandemic, unfortunately I think it's a statistic that's not that hard to appreciate. So PCTI recognizes that a traumatic experience can impact somebody as they age, and it doesn't just go away, the impact of it. It could be over the course of their lifetime. Mm-hmm. So the sort of definition that we use around PCTI, I just thought I'd read it just to kind of put a frame around it, is a holistic approach to service provision that promotes the dignity, strength, and empowerment of trauma victims by incorporating knowledge about the role of trauma in victims' lives into agency programs, policies, and procedures. So it's a lot, it's a mouthful, it's a lot mm-hmm. to sort of take in. But in addition, the SAMHSA, the Substance Abuse, Mental Health and Service Administration, had put together an article about trauma-informed care, and they outlined 6 principles, which I think really kind of round out how PCTI operates. So the 6 principles include safety, trustworthiness and transparency, mm-hmm. peer support, collaboration and mutuality, empowerment, voice, and choice, and the last is cultural, historical, and gender sensitivity. Okay. And when you think about all 6 of those principles, I really think they all sort of combine together, and they all sort of lead really into safety, with safety being kind of the most important.
Right.
You know, the overarching piece of PCTI is that everyone deserves to feel safe physically, to feel safe emotionally, psychologically. And trustworthy and transparency feeds into that. If you're working with someone who's providing care for you, or you've reached out to someone, that you have the sense of trust, that you know that you're all working towards the same goal and the same end. And peer support is to give people a sense of sometimes you're not the only one, and that there are people, others, whether it's a provider or a other patient or other fellow colleague, that have maybe experienced something similar. Collaboration and mutuality, that you collaborate, that you work together, which really feeds into empowerment, voice, and choice. I think, you know, the idea that when someone's been through a trauma, one of the things they lose in that experience is control. So if you empower someone to sort of be their self-advocate and be part of the decision-making, you give them that modicum of control back in some way. And finally, the cultural, historical, and gender issues, that we sort of be aware that people come to life and the world from different areas, and they have different beliefs, and that we sort of don't just dismiss things out of hand, but you have sort of a context, again, to give people a sense of safety.
Right. So it's a lot about the safety and the context that someone is coming from in their experience.
I think that's right, yes. Yeah.
Thank you. So Dr. Drew, let me ask you, how did you get involved in dental care for Holocaust survivors?
Well, first, Kathy, I wanted to thank you for having me on your program.
Thank you for joining us.
Last year, I received an email from my Temple B'nai Abraham in Livingston. It was actually an email chain. The original email had come from Debbie Rosen from the Federation, and she was asking dentists in the community if they were willing to help serve the Holocaust survivor patient. The email really hit home. Both of my parents were Holocaust survivors. My father, Marty, he's been deceased almost 25 years, but my mother, Esther, is still alive and well and will actually be 96 next year. They had always suffered with dental problems throughout their lives. And of course, it was attributed to this horrible Holocaust concentration camp environment, an environment that we know had no medical or dental care, unsanitary conditions, poor nutrition, no oral hygiene aids. When I got the email, I thought about my career. I've been a dentist for almost 40 years. My first 30 years, I was in clinical practice and always had an academic affiliation with the local dental school. The last 10 years or so, I've been full-time, and I thought that Rutgers Dental School could be a wonderful place for us to give these worthy people care. At that point, I contacted Debbie Rosen at the Federation.
So why do you feel that Rutgers School of Dental Medicine is a good place to administer this dental care?
I actually think it's an ideal place to administer this. It's a state-of-the-art facility. We have the most medically advanced equipment. We have a faculty that is excellent in clinical dentistry, top researchers, top authors, a wonderful place. I also had been involved in both teaching the DMD candidates as well as the postdoctoral students. So I was aware that we could offer these patients everything from the most simple procedures to complex rehabilitation and even taking care of medically compromised individuals. What really made me know that Rutgers was a great place for this is after I took the PCTI training. It was amazing because what I learned was that the Holocaust survivor, their number 2 issue is dental care and dental issues. And we can really handle this. At Rutgers, we can give the people the dignity, the strength, and empowerment to help them seek therapy. What I like to say is we're giving them VIP therapy in a vibrant environment. We have youthful DMD candidates, residents, and a staff and administration, and all ready to help the Holocaust survivor patient.
That is so great to hear. So how does the system work at Rutgers?
They are taken up to screening where Dr. Moran, a fantastic dentist with great clinical expertise, can examine the patient, take any necessary radiographs they need. Right away, the patient feels that they are in a safe, trusting, transparent environment. Okay? We've created what's called the Patient Navigator System. This allows for the Holocaust survivor to have any questions handled so they can properly address any medical or dental issue. We've taken the stress of finances out of the equation. There's no cost for any care they will receive. Most importantly, simple procedures can be given to a DMD candidate. Every step is verified and checked by an attending faculty. If it's advanced therapy, it goes to our postdoctoral residents. They are now doctors, doctors who are taking 3 to 6 years of advanced training in their specialty. They are always surrounded by specialists. What makes Rutgers so unique, they come to the postdoctoral center, they're surrounded by all the specialists. So if they need a consult in orthodontics, periodontics, prosthodontics, endodontics, radiology, oral surgery, it's all under that umbrella.
Okay.
The Patient Navigator System is fabulous.
Thank you for explaining that. So when this started, how were the providers of care prepared so that they could treat Holocaust survivors and use the person-centered trauma-informed care approach?
Well, Rutgers has a terrific community center, community department, okay? And what they've taught all the people in the school is how to treat many different problems, people who are mentally or physically challenged, trauma victims like veterans, people maybe who've had domestic abuse or violence. But then when Debbie and the Federation arrived with PCTI, it was another level.
Okay.
We're getting tremendous help, and that training is helping us handle all these patients even better. We've taken practical steps. The physical space allows for anyone handicapped, anyone in a wheelchair. There's elevators. There's a dedicated phone line. There's the patient navigator and dental advocate. They're available to handle any questions, any problems. We're there for these patients. We're providing them comfort and awareness.
Excellent. And so far, what are the benefits that you've seen coming out of this program?
The benefits are many. Of course, number one, it's so important that we're giving people knowledge and awareness of the Holocaust. But as I mentioned, the PCTI training goes to other disciplines.
Exactly.
Could help us with our veterans, could help us with our abused patients. Okay? Now we're in a pandemic. So many people are suffering from isolation, loneliness. The PCTI training is there to help. Okay? Additionally, it's given a certain aura to the school. We want community service. We want to promote philanthropy. What we know is that the Holocaust survivor patient has endured enormous cruelty. It's our job to recognize them and to give them the comfort and care they need. Rutgers is so proud to be part of this program.
Thank you. And then I'm going to turn to Liz. And can you explain, we've talked about aging, the process of aging, but what is aging like for Holocaust survivors?
Yes, Kathy. Well, thank you for having me. So each and every victim of trauma, PCTI teaches us, has a unique history and a unique life experience throughout their life. But what we know for Holocaust survivors, they've experienced significant trauma. Part of that is loss, the loss of family and friends. We say they don't have a roadmap to aging. Most didn't watch their parents and their grandparents get older.
Okay.
They spent their life surviving. They don't really know what it's like to get older. Aging in and of itself is a trigger. We know that aging comes with many, many losses and triggers: loss of friends and independence, mobility, not being able to walk, losing our senses, our sight, and our hearing. And you may be surprised to know not all of survivors have PTSD. They're not going to be diagnosed in that way.
Okay.
But many have lifelong symptoms. And aging can bring that out, whether they're symptoms of anxiety and depression. They may have flashbacks. There may even be challenging behaviors that are not recognized as symptoms of a trigger of aging. Then you bring into medical care, which can be another trigger.
Okay.
So there can be uniforms, a sterile environment, very bright lights, showers. All of these things may make a Holocaust survivor and other victims of trauma just feel unsafe. So
Right.
part of PCTI, and as Dr. Drew spoke of, is all of us as providers understanding first that aging is different for Holocaust survivors and victims of trauma, and what can we do to bring safety to access care.
Thank you. So then how can a survivor, caregivers, other victims of trauma, and the people who are caring for them, how can they ask for the care that they need?
So that's a good question. What I first would want everybody to know is that any victim of trauma, whether a Holocaust survivor and really anybody, that you have the right to be treated with dignity and respect,
Okay.
and the right to have choices and to feel empowered and to have collaboration with your team to be able to safely access that care. So what does that mean? You need to know that you can ask for that care. And what I want you to think about is you may not feel comfortable asking for that care. So if you're not comfortable, I want you to bring somebody with you, whether it's a loved one or a friend or a social worker that advocates. Advocacy is key. You may not feel comfortable sharing your story, but if you do, I've worked with caregivers that will just tell a provider that my mom is a Holocaust survivor. And things change a little bit. It's subtle, and it shouldn't have to happen that way, but it does. You should feel that this is part of a collaborative process to know that you're the expert in what you need. And the idea being that you need to be given options, options of treatment, clarification. There may only be one plan of care, but I want you to leave that doctor's office understanding what it is that they're going to be providing, what are the side effects, what are the benefits. And then Dr. Drew also spoke about barriers to care, which is very important. Before we even get you to the doctor's office, I want to know that you can get there safely. Do you need transportation? Are there stairs? Are you going to feel comfortable in the waiting room? Is there technology? Do you have to fill it out on an iPad? Do you know how to do that? Because the less stress that you have, the less triggers that we're going to have, and the better care that you're going to be able to receive.
So being your advocate or an advocate for the person you're bringing for care is the important first step in this, in getting the care that you need.
Yes, and recognizing that it's your right
It's your right.
to have that care and to be able to ask for it.
And can you just tell us quickly how does the Jewish Family Service of Metro West incorporate PCTI?
So I feel like PCTI gave us language and principles for the social work that we already do.
Okay.
But we were able to take the principles and integrate it into everything from the very first call at the front desk up to our management, with the language that we use, with the marketing that we have, to look around the environment and the art that's on the walls and the light that is there. All of our staff has received training and ongoing supervision. We want to make sure that our clients, all of them, not just victims of trauma, feel safe. It's applicable to everything that we do.
It is, right.
And that we understand their history to provide better care.
So Peter, now turning to you and in your work, what are other types of trauma that older people might experience?
One thing when it comes to trauma is to keep in mind that trauma itself could be a single event or a cumulative event across a lifetime.
Okay.
The program that we have, Project Cease, which addresses elder abuse in Union County, serves individuals who have suffered from elder abuse. And there's various forms of elder abuse, whether it's physical, financial, verbal, sexual abuse, and or neglect or complete desertion of an older individual. Our program at JFS came to recognize the growing concern of elder abuse throughout the nation. The fact of the matter is 1 in 10 individuals 60 and older experience some form of abuse. And so we address elder abuse on a spectrum. We understand that it is just not a black and white issue. There's a lot of gray in it. And so we know that these are lifelong relationships. This is trust that has been broken, and we work to cultivate that. And so we take a nuanced approach at Jewish Family Service through Project Cease to ensure there's mental health services, from counseling, case management, to nurse consultations and home health aides, to transportation and kosher Meals on Wheels, as well as access to a food pantry. So we put all these wraparound services to ensure our clients get the care that they deserve.
So all the services that
All
they
the
can need.
services are there. And I'll say this, as a society, I think we need to switch our framework. You know, we need to switch our worldview from seeing older adults as objects of care to people to empower.
I absolutely agree with you. Well
We
said.
see them as individuals who are frail and vulnerable, but the approach we take is to see it as a two-way symbiotic relationship. This is not just us giving them services. This is about us building community ultimately, and we do that through this approach, and we do that through our philosophy.
Well, thank you. Those are very strong points, and I absolutely agree with that. So I wanted to ask you, so when PCTI is utilized with those who have experienced elder abuse, how do you bring that in? How do you educate the community on utilizing the intervention?
So we do community education for agencies. So we go out and educate agencies and the community at large with regards to how you could utilize PCTI, person-centered trauma-informed care, in your practices. So one example is Legal Services of New Jersey and Union County, who approached us with interest of utilizing PCTI to de-escalate a crisis circumstance. So we use the framework of PCTI to discuss how you ensure a sense of safety. You know, when you have a client coming, is the office well lit? Do they have a space to safely discuss without the undue influence of intimidation by a potential abuser or perpetrator, confidentially what's going on for them? So we ensure those kind of things when we talk about safety. We talk about building trust. Often when it comes to the criminal justice system, they want all the facts and evidence right up front. And that could be re-triggering, that could be re-traumatizing for individuals. So ensuring that you listen is key, providing affirmation and validation for individuals, whether you're doing that in your office or one-on-one with an individual. And the other guiding principle I like to talk about is empowerment. So when we do those things and we create a plan after we create trust with an individual, asking them, hey, what happens if you're alone and you need support? Could you get to a phone? Who do you talk to? Are you in touch with members of your religious community or your doctor? Could you easily get in touch with friends and family? So once we create that plan with them, that gives them that sense of empowerment where you kind of show them the door and they have the ability to open it and walk through it.
Right, excellent, excellent. Now, I do think that people are more familiar with child abuse and what to do and who to call. They're less familiar with elder abuse. Where do people go if they suspect, if they're a victim or they suspect someone else's? Who do they call? Where do they go?
It's a great question, because when it comes to child abuse, everybody's heard of Child Protective Services. But if you're an older adult, where do you go for help? And sometimes where do you go for help is just as important of how do you ask for help. There's many programs, including our own at Project Cease, contacting us. Every county in the nation has a sanctioned organization to do investigations for elder abuse, the Adult Protective Services, or APS. If it's an institutional form of abuse that's in long-term care facilities such as nursing homes, we direct you to the Ombudsman Services and 911. You know, we're 9 to 5, but 24 hours a day, elder abuse just doesn't happen between work hours. So calling 911. And I'd also like to touch on the fact that, you know, a part of this approach is ensuring peer support. When we talk about PCTI, what we're talking about is building a sense of connectedness. Often there's a lot of stigma around asking for help. And so I would encourage people to first contact maybe your doctor, or encourage somebody to speak to a family member or a religious leader in their community, as it's less stigmatizing, and have those individuals connect us to resources. And contrary to popular belief, it is not a weakness to ask for help.
Right.
Rather,
Right.
when you ask for help, you're getting connected to somebody in your community and ultimately strengthening your community. And that's what PCTI is ultimately about.
Very, very good points. And I want to thank all of you for joining us today. What is so impressive about this approach with PCTI is what I'm hearing is when you train dental students or faculty or staff, and when you are working with elder abuse and when you're doing social work, the training for this can be carried on to impact and affect and benefit so many other people. It's a way of doing it. It's a view of the world. It's a view of the older adult. It's a view of people and the trauma they experience and how to help them. And I really appreciate you coming in today and explaining this to us, and I hope that our audience learns a lot from this. I know I did. Thank you for watching this episode of Aging Insights. To view previous episodes, please visit our website at www.njaaw.org and click on Aging Insights. Aging Insights is brought to you with the support of our funders, supporters, and viewers like you. And I'd like to say thank you for our partners here at PCTV for helping us bring this program to you. If you suspect abuse, neglect, or exploitation of an older adult living in a community setting, or if you are a victim, contact your county's Adult Protective Services. You'll find a link to New Jersey Adult Protective Services on our website. NJAAW wants to remind you to stay safe during this pandemic, and please reach out to older adults who may be isolated, lonely, or in need of assistance. And don't forget to like and subscribe to our show on our YouTube channel. Thank you, and join us again for our next episode of Aging Insights.